2:12, and I'd like to call the Health and Human Services Committee meeting to order. The first item on the agenda this morning, or this afternoon now, is public comment. If you wish to speak, please come to the podium, state your name, and you have 3 minutes to speak to the board. Would anyone like to make public comment?
Cindy Mushrow, Spring Lake Township. And I would like to speak against the vindictive and petty campaign being waged against the health department by the OI affiliated commissioners. The health department was following health directives, advice from the CDC, AMA, American Academy of Pediatricians. I could go on. That is what our health department should have done during a pandemic. They should not have followed the directives of Joe Moss and his children's religious school. They are the health department, not a religious or political organization. They should have been punished if they did not follow accepted medical guidelines, not for doing so. Stop your vindictive campaign. It is wrong, and the taxpayers of Ottawa County are paying the price both figuratively and literally for your actions. And just as an aside, since I have more time, what is your problem with this? I keep hearing you come up using condoms against the health department. Colleges have been distributing condoms. Health departments have been distributing condoms for as long as I can remember. And I am on Medicare. This is not a new thing. I have to assume your issues are religious, and I acknowledge your freedom to give your children questionable health advice based on your religious beliefs, but that freedom stops with your children. It doesn't extend to my children, my grandchildren, other people's children on college campuses. It's ridiculous to hear you bring up condoms on college campuses like the health department committed some kind of sin. They're a health department. Thank you.
Thank you. Would anyone else like to speak? Okay, moving on. Next, we have the approval of the agenda. Is there a motion to approve the agenda?
So moved.
Do we have a second?
Second.
It has been moved and seconded to approve the agenda. Do we have any discussion? Seeing none. All those in favor of approving the agenda, please say aye.
Aye.
Those opposed say nay. The agenda is approved. Moving on to consent resolutions, we have one item under our consent resolutions, which is the approval of the proposed minutes from the September 19, 2023 Health and Human Services Committee meeting. Is there a motion to approve the consent resolutions?
So moved. Support.
It's been moved and supported to approve the consent resolutions. Is there any discussion? All those in favor of approving the consent resolutions, please say aye.
Aye.
All opposed, say no. The consent item is approved. As we have no action items for this meeting, that moves us to our committee reports, where we will receive updates from several departments. And we will begin with community mental health, and we welcome Lynn Doyle.
Good afternoon.
Good afternoon.
Happy to give you some updates from CMH. I have let you know, I think a couple meetings, that we were restarting our Children's Mobile Crisis Team. Due to some technical issues with the phones and some staffing issues, we've had to delay that community-wide start of the program. However, we're at a point where we'll be going live with this service by January 8th. The schedule for rollout is as follows. For the month of December, we're contacting our community partners to provide information and RAC cards for lobbies. And like I said, by the 8th, that's going to be a service that's going to be available, and hopefully by then also widely advertised. There's two ways to get in touch if you do need that service as someone from the community. There's a dedicated website, and there's also a dedicated phone number. It's going to be available Monday through Friday, 5 p.m. to midnight. Our community crisis intervention team will cover phone calls from Monday through Friday from 8 to 5. And then the times that is not covered by either one of those crisis services, our 24-hour crisis hotline is available as well. We're hoping someday to get that to be a 24-hour service. Right now, staffing remains the biggest issue with that. Our Ottawa County Opiate Task Force helped to sponsor a medication take-back event on October 28th. The partners included the Sheriff's Department, Holland PD, Coopersville Fire and Rescue, Holland Hospital, and Corwell Zealand Hospital. They collected 436 pounds of meds. If you add that to the stuff that was in our drop boxes, our permanent drop boxes, around that time, it was closer to 600 pounds of unwanted medications were collected. We had 195 people participate, over 100 medication lock boxes were distributed, bags, 55% of the individuals dropping off meds disposed of controlled substances. And those included opiates, sedatives, and stimulants. The good news is that these kinds of events help to, they're a preventative effort to make it easier for the community to safely dispose of meds instead of having them be in their med cabinets or something where, I don't know, someone could inadvertently take that medication or do it on purpose. Then we don't want that to get into their hands. So that was, I think, a worthwhile effort. That's something we do on a routine basis every year. We have issued a request for proposal to solicit proposals for the opiate settlement dollars that the county is receiving. This is the national settlement amount that the dollars are being collected to account for the deaths that occurred for the over distribution of opiate pain medications. The priority areas for the use of funds that we've identified include providing childcare services during treatment, or recovery meetings, recovery housing, increased access to medication-assisted treatment, additional behavioral health workers to expand wraparound services, and also looking at providing treatment for individuals with opiate use disorder while they're incarcerated. So far, we've received about $500,000, and over the next 15 years, that number is going to be closer to 2.7 million. So I can give you an update once we're done with that RFP and we've selected the organizations that we're going to work with. One of the other things that we've accomplished lately is we generated our annual strategic priorities, for fiscal year 24. Some of those priorities include improving access to care, staffing and retention, having a quality system of care and integrated healthcare. Though the strategic priorities are listed on our website if anybody would like more information, or I'm happy to answer questions about that. Finally, we continue to struggle with staffing shortages, both in-house and with our contractual providers. We have currently 11 vacancies in-house. And it seems like just when we hire somebody, someone else resigns or retires, which is not a bad thing, but I do appreciate some of the proposed changes for wages and benefits because I think that truly will help. So that's all I have unless you have questions.
Does anyone have any questions for Lynn? Commissioner Meadma.
Hi, Lynn. Thanks for being here. Would you like to give out the website and phone number today while you're here, just to have that on record for the public, or is that for later on as it rolls out?
Yeah, if you don't mind, I'll at the next meeting, I'm happy to report that. I can also bring some rack cards. It's just,
Okay.
right now we're still in that phase of working closely with some of our partners to work out the bugs before we go fully live.
That
So,
makes sense.
Okay.
Thank you.
mhm.
Any other questions for Lynn? Okay, thank you.
Thank you.
Okay, next up, we have Jennifer Brzezowski from Community Action Agency. Good afternoon.
Good afternoon. So at Community Action Agency, just a couple of updates. I think I mentioned early in the fall that we had our first public health intern, Kirsten. She is wrapping up this week. Really, really excited about all the work that she did when she was with us. She did some outreach and marketing for our upcoming Walk for Warmth. She's actually out helping with our senior food distribution currently. And then she also worked on a customer satisfaction survey for our clients. Really great results, and it's also going to help drive future survey questions and some projects that we'll have in the future. I'm going to sound like a broken record for the next couple of months because Walk for Warmth is coming up March 8th at EV Construction on 6th Street. This year is going to look a little bit different than years past. We will have a registration fee that will go directly toward utility assistance. If any of you tried the pizza out there, and it was amazing, Pizza Parliament will be there. The food truck will be there at the event, so we're excited to have them. It's also going to be hosted on an evening, so March 8th is a Friday. It will be at 6 p.m. so that we can do a sunset walk on window on the waterfront, and then come back afterwards for a glow party. So we're looking forward to that. And again, just a reminder for those of you who don't know about Walk for Warmth, every dollar that we receive goes towards utility assistance for individuals that cannot afford their utility bills. I also want to talk about our Home Energy 101. I shouldn't say ours, but we're one of the providers, which is a partnership through the Holland Energy Fund, which is City of Holland and Holland Board of Public Works. So it's a really great service that we offer. It's free energy education for those that have high energy bills. So one of our inspectors will go out, take a look at either the rented unit or the home, talk to them about energy efficiency, and then afterwards they receive a free kit valued up to $300. So it's a really great service, totally free, optional for Holland Board of Public Works customers. So we definitely want to promote that effort because it's free. It's a great thing for the community. We were recently assessed by the state. It's something that they do every year. It's called their STAR assessment, the State Technical Assessment Report. And I'm happy to announce that we received a rating of 4.52 out of 5. So we were high in a lot of areas. One area that wasn't as high was on grant spending. So a lot of that is primarily due to our weatherization program, which I've mentioned before is ramping up. So as long as we're able to get contractors onboarded, then we can complete our units for the year, and that will help us with grant spending. And then lastly, just a couple of contracts that will be coming your way, Chairman Moss, is for Brummels and our weatherization contractor. So those contracts are essential in doing our weatherization work. So we're looking forward to getting started with those contractors so that we can keep our jobs moving along. Any questions?
Any questions?
Yeah.
Commissioner Bonema.
It was a great event, the Walk for Warmth. Do you have a little story that stuck with you from a family or a person that you helped in the last couple of years that you could share of the value of this program, how it helped them?
Yeah, absolutely. So our community action in general we're really trying to lift people up out of poverty and have them become involved in their community so they can give back while we're giving to them as well. So actually one of our board members is somebody that benefited from our utility assistance. So she received our services and now she's a board member. So she actually advocates for our services out in the community. So I think that's just a really great example of what community action is all about, is really a hand up, not a hand out, making sure that people that are served are, we're providing them with resources, with education and information they might not have had before. And then they can give back to their community in other ways. So I think that would be one that really sticks out for us.
And then I remember too, because Veteran Services or Veterans Benefits is kind of next door to you, that
Mhm.
there's times when some of our county veterans aren't able to qualify for certain benefits, but do qualify for help from you guys. And so
Yeah.
I think the public should know that there's lots of other benefits for our
Absolutely.
veterans community through you even.
Yep. So eligibility for the majority of our programs is income based. So it doesn't matter, veteran, not veteran, whomever it may be that needs the help. It's really based on income. So we are willing to help anybody that needs it.
Thank you.
Anyone else? Commissioner Ebo.
Yeah, that home energy education that you
Yes.
provide. So how
Yes.
many families took advantage of that for like this past year? I don't know if you had the numbers or not, but
Yeah, I wish I had the numbers on me. What I can tell you is that there are other community partners that are doing that as well. So we're one of, I believe there's 4 or 5 other agencies that do it as well. The advantage, I might be a little biased, but the advantage of coming to our agency is that if they realize that they maybe have more work that needs to be done than what our inspectors can do or what the kit will help with, then if they're income eligible, then we can transfer them over to our weatherization program, which is a more robust program that can go in and do a lot more than what the homeowner or renter might be able to do. So I wish I had those numbers. I don't want to guess and be wrong. So, but I can send those to you if you're interested.
I was just saying a lot more than last year, kind of that kind of.
It is new. It started, I believe, in November of last year. It kind of ebbs and flows. So there's some months, you notice if there's a lot of marketing, then the numbers spike, but I can definitely send that to you. The number of individuals served from our program, I should say.
Thank you.
Hey, anybody else? No? All right. Thank you, Jennifer.
Thank you.
All right. Next, we have the Public Health Department. And looks like we have Marcia coming today. And Lisa.
Hello, Commissioner. Yes, Marcia Mansouri, Deputy Health Officer. So we've got union negotiations going on right now. Administrator Gibbs is there with Adeline. And so I stepped out to do this and then we'll join them again. So this will be pretty brief, but feel free to ask questions. And if I don't have an answer for you, I'll make sure that we get it provided to you. So I would like to provide, this has actually been provided to Mr. Jordan, and this is interesting. We got a Jack Jordan and Jordan Epperson. So both Mr. Jordans have gotten a copy of this, as well as Administrator Gibbs and Commissioners Bonma and Zalstra, since they asked for it. But I have other copies. Mr. Epperson, would you like me to give you a packet in case you want to see this? This is a draft resolution that we're putting forward related to the Ottawa Food Coordinator position. And it's something that you could bring up at the next Finance and Administration Committee if you so choose. So I'll just read it through quickly for you. And if you have any questions, and hopefully you'll be able to view it as it comes around. So Addie, type this up. To approve, so the suggested motion is to approve and forward to the Board of Commissioners the request from Public Health to increase the general fund contribution to health education, and it gives the line item there, $121,274 to fully fund 0.9 FTE for a health educator to work in the Ottawa Food Coordinator role for fiscal year 2024. There's an asterisk by health educator, and you can see it's referenced right below that suggested motion. We don't expect another employee to bump, but they have that option. It's possible that it could happen, but it's unexpected, but we just wanted to note that. So if someone is more senior, they would usually increase that cost then because their pay would be higher. So a summary of the request, the health education and nutrition budget was reduced 48% for fiscal year 2024. As a result of this reduction, the 0.9 FTE health educator assigned as the Ottawa Food Coordinator was reassigned to the Food Safety Environmental Health Essential Services section. There have been significant conversations around this position, both in the community and at Board of Commissioner meetings. It was stated that requests for additional funding should be presented to the Board of Commissioners for consideration. In recent conversations with Administrator Gibbs and Deputy Administrator Wetmore, that was actually on Friday when Adeline had her one-on-one, Administrator Gibbs stated that he was confident we can find a solution, but it was clear that it may involve approaching Ottawa food member organizations to drive that solution. Adeline will continue down that road if it is the will of the Board of Commissioners. However, she recommends a solution that would be to continue funding the Ottawa Food Coordinator so that the coordination of county-wide work can continue to move forward. Most of the organizations do not serve countywide. I'm not sure if any of them do, actually. Lisa may be able to help in that. The work of Ottawa Food is not mandated specifically, like having Ottawa Food is not a mandate. But the work helps to assure mandated program requirements to provide health education and nutrition services and that those are met. So this is a draft action request for such consideration of adding funding to restore the Ottawa Food Coordinator as a county-wide position. And behind it and attached, so it's like all double-sided, there is something that some of you may have gotten already, but it's a little more thorough description of a breakdown of that funding request, more information about Ottawa Food, what the one health educator who is still working in health education is doing, et cetera. So that's for your information. Before I move on to item 2, is there any pressing question about that? Okay, thank you. So this is the Health Department's Hudsonville office update. Press release will be issued soon to notify the community that office hours have been significantly reduced at our Hudsonville site. That was actually happened on November 3. To allow us to reallocate expenses and to address reduced staffing capacity. So kind of a two-pronged reason. 1 half day a month, possibly up to a whole day, is still available to schedule appointments for those individuals who are unable to come to the Holland or Grand Haven offices for services. Number 3, hiring and retention of staff. This is a theme. I've heard it from other people. You addressed it in one of your meetings today with some really encouraging, I think is well supported suggestions. So I alluded to this issue also as I talked about the Hudsonville office. Staffing capacity, hiring and retention issues were being experienced this calendar year in a way that we haven't experienced them in previous years. So staff turnover this year is higher in 2023 than in any previous year since 2013. That does not include, though, the 2 COVID years of 2021 and 2022, where we had staff, temporary staff, kind of coming in and going out to assist with that pandemic response. We're also running into issues with hiring for open positions. Recently, we had 6 interviews scheduled for an open clerical position, and 5 candidates just no-showed on the interview day. So we're collecting and analyzing information to better understand what is occurring and how much, to the extent. Recently, there were some conversations again on Friday at the one-on-one with Administrator Gibbs and Deputy Administrator Wetmore around these issues. They floated a few ideas around how to retain current staff and attract new staff. These ideas are in the preliminary stages, but we may be coming to you in the months ahead with some proposals. I brought just a brief little table with me. In 2023, so far, we've had 25 staff separate from the health department. We have 18 staff who have been promoted or gotten hired into a brand new job. So it's something that they're not familiar with. And we have 12 FTE at least. I'm continuing looking at the information and collecting more. But so far I've identified 12 unfilled FTE. So our capacity is a little bit strained. One of our divisions is a type of division, the environmental health division, where people have to come to us basically, and there isn't anywhere else they can get their restaurant inspection done or their kitchen approved, et cetera. So it's a little easier since it's not voluntary or optional to look at the numbers and to look at how we're doing. And so it's it's kind of the canary in the coal mine for us. Gives us an idea of when we might be stressed and behind and under capacity. So we're about 3 weeks out for applications for well and septic permits with 30 that are in the queue. We are a lot more comfortable when we've got 15 or fewer in the queue. We don't like people waiting for those. Sometimes they're connected to development and real estate sales. So for food inspections, we are behind. And we recently scaled back schools to receive just one inspection instead of the 2 that they normally should do. These sorts of things could possibly cause us to have conversations with the state. So we're very encouraged by what you're thinking through on how to retain and attract staff. And we want you to be aware of what we're experiencing. I know you're hearing it from other departments as well. Any questions?
Commissioner Cosby.
Hi there. Hey, thank you, Marcia, for your presentation. Question for you. It sounds like you have tracked since 2013 the turnover rate for the health department. Are we able to get a look at that? Would that be something you would provide to the Board of Commissioners?
Absolutely can. I can read it out to you as well.
I'm kind of a visual person,
Okay.
Marcia. So yeah, I would appreciate, you can read it, but I'd appreciate if I could take a look at it too.
Just really briefly, I won't read it out that way, but like 25 so far this year. We don't know what will happen in December. Between 15 and 20, 2015 and 2020, we had about an average of 8 that would leave for one reason or another. 2013 to 2014 were double that. So about 13 and 14 each of those years, interestingly. For 2021 and 2022, I can't give you that information right now. What happened, I'm working with human resources. We pulled people who had retired because they knew the work and we knew them. And it was really easy to not have to do a really big interview session when we're trying to bring in a whole lot of people in a very short time period. So what happened was their initial leave date got overwritten by their leave date following COVID. And so it's not accurate and we need to dig into that and go through it. So I got like nothing for 2021 and 2022, but I will hope to fill that in. So when I send this to you, I don't want you to be shocked by the fact that those are empty. I'll make a note so you understand why.
Yeah, and it sounds like you may have done the 2 other things I was going to ask about were how many of those positions were grant funded? And then also how many of those were due to retirement? Do we track that information?
We track retirement. So I know, if they left for quit, laid off, or retired or fired. So we have those categories. I'd have to look into the grant funded. I do know for this year, it's really easy because it's information that we know in our heads right now. So of the 25 staff, see 7 of them during this entire calendar year were COVID funded staff. And so one of them left earlier in the year and then 6 on September 30.
Okay. And I don't know if it's the same, in the health department, but in like health systems, when we receive grants, it's typically to get a program started that we want to eventually integrate into our budget. But we know that that's going to be kind of a short-lived, kind of by the grace of the state or federal dollars providing. Is that something that you do at the health department, plan to budget if it's a program you want to keep over time?
We get grants for all types of purposes. One, just like you stated, it can be startup funding for a new program or a pilot that may or may not continue. And then we're expected to find a sustainable way to fund that. But we also have partnerships with other agencies where we receive funding each year to carry on a portion of the work that the state or a region is looking to accomplish. And they've partnered with us to do that and provide some of the cost for staffing. And so it's usually ongoing for a longer period of time, may not last forever though.
Okay. And would you say that our grant funding at the health department has increased or stayed kind of stable over time? Let's say from 2013 to now.
I would say it's pretty stable, different. It changes. as needs change. But yeah, I would say it's pretty stable. Again, not counting COVID, because that's an anomaly within this
Right.
time period for sure.
Right. Thank you very much.
Thank you.
Mr. Miedema.
I think just adding on to some of those stats, I think I'd be curious to know how many people were employed from 2013 till now? And then
As an
the
entire
stats,
amount or per year?
both,
Okay.
and then understanding
We're thinking
the
alike.
the turnover rates, right? The turnover rates,
Mhm.
and according to how many staff were also employed. So not just
Yes.
saying like how many people left in that year, but in correspondence to how many were actually employed as well.
That's good. I like that. I would like, well, I made a request for the number and also the FTE, because we tend to have more number of people employed than we do FTE, but I think they're both informative numbers. So if I hope to give them both to you. Zach, the deputy at HR, is going to work with me on that to make sure that we both agree. And that's going to take a few weeks before he's free to be able to do that. So maybe, hopefully by the January meeting.
Sounds good.
Okay, but it's a very good question.
Okay, anyone else? Nope. All right, thank you.
Okay. Thank you.
Right. And next up, we have the Department of Health and Human Services, Kendra Spanger.
Good afternoon. So I did one of the follow-up questions from the last meeting was around Medicaid and ages. I believe Joe had asked that question. So to provide an update on that real quickly. So we pulled all the data from kids 0 to 17. 17 was our lowest number with 1,024 17-year-olds on Medicaid, and our highest was age 7. Which is 1,211. So it ranged from 1,024 for every single age up to 1,211, with a total of 21,357 kids on Medicaid. Mind you, that also includes there was 317, and those that are over 18 but could still qualify as a child depending on education, and that's 413. So again, 21,357 kids as of October on Medicaid. One of the data points that was asked for since we met as well through a different entity, but I thought would be helpful for all of you, still related to Medicaid and the changes due to us processing redeterminations. Actually, the request came from the Holland Free Health Clinic to the health department, and the health department reached out to me directly, which I appreciate. Some of the data points I thought might be helpful for you to know. In March of 2020, so obviously before the pandemic changes that we had with Medicaid, we had 27,844 individuals on Medicaid and 8,758 individuals on Healthy Michigan plan, which Healthy Michigan does allow for a higher income level. And so after that date, we were not able to take people off of Medicaid due to the federal public health emergency. As of May 2023, we were able to start taking people off if indeed they were no longer eligible. So in May, we were at 38,274 individuals on Medicaid and 16,813 that were on the Healthy Michigan plan. So a pretty significant number from those 3 years. As of October, so after we've started doing the redeterminations, we are at 36,832 individuals on Medicaid and 15,542 on Healthy Michigan. So a total of 52,374 individuals are receiving Medicaid here in Ottawa County. So just from those 6 months of starting redeterminations, it's only a difference of 1,442 on Medicaid and 1,271 on Healthy Michigan plan. A lot of people were asking if there was going to be a significant number of people that were going to be cut off. And based on that data, my response would be no. So we're still up almost 15 or over 15,000 from 2020. So a pretty significant number of individuals still receiving Medicaid. In addition to that, I thought it might be helpful. I know there's been a lot of conversations related to the food assistance program. So I thought I would provide some of that data as well for October. In October, we had 9,211 cases or 17,653 recipients of the food assistance program, or most people know it as the Bridge Card or EBT. And of that, 10,378 were adults and 7,275 were children. That brought into Ottawa County alone, just in October, $2,903,173. Of that, $315.19 is the average amount per case that is provided, which is an average of $164.46 per person. And we average 1.92 recipients per case. So just in case that information is helpful to you. And then I did want to say thank you very much for participation. I know all of you unanimously voted for the resolution for Adoption Day, and many of you were present. Thank you very much for supporting that day. We had 5 youth that were abuse and neglect children out of the CPS program that were able to be adopted on that day. So thank you. We've had a total of 20 youth here in Ottawa County that have been adopted since January. So in case you were interested in those statistics. Thank you. That's great information. And then I know I walked in late to a meeting earlier, and I just wanted to say how much we appreciate a lot of the collaborations that we have across all of our agencies. And I know there's been some discussions, and I just wanted to provide some thoughts and feedback. There's been questions on the lock bags, and I just wanted to say that we as a department have greatly appreciated the ability to have the grant funding for the lock bags. We at our office have used them for prevention, child protective services, and adult protective services cases, and have given away over 200 bags for a variety of reasons. Not just, I know the concern, a lot of people are talking about marijuana. A lot of it's prescription medications. And so especially with older adults that may not be able to have medication, someone else has to give it to them. So it's things like that we definitely have found real big benefits for preventive efforts. So just want to let you know that we appreciate that those have been provided to us. We have definitely used those for abuse and neglect reasons. So I think that's all that I have. Any questions?
I have one question.
Yeah.
I'm wondering about your Medicaid number changes.
Mhm.
Have the standards or the qualifications to obtain Medicaid changed at all? So they've stayed the same, but the needs, either people are obtaining them more or the needs have increased? Is that what you're seeing?
Yeah, so the standards have not changed. So we still have about 6 months left of redeterminations. We have to have them completed by June of 2024. So there's still about 6 months to go. There's been a lot of great efforts in our community to make sure that people are continuing to be eligible if they're eligible. So I think there's definitely been a little bit more education provided to individuals to make sure they're getting their addresses up to date with the department, that they're communicating with their workers, they're returning their verifications. So I think there's just been a better education, I think, out in the community, and people that maybe didn't apply before the pandemic because they didn't feel like they needed it. Then they did apply and realized, ooh, I really could have stayed on this. And so again, I think it's a lot to do with education, not to say that there wasn't people that maybe could have taken advantage of it in 2020. But at the same time, are there more people that could be eligible just because of income and using their money in other ways? I would say it could probably be both.
Right. Any other questions? Oh. Mr. Coran.
Thank you. Kendra, I just wanted to see if we get an update on where we are at with foster parent or foster homes that are required for the Ottawa County and how many more you need.
Yep. I will plan on it for next month. And I know you'd asked about recruitment events.
Yeah.
And I did connect with both our licensing supervisor in our office, Arbor Circle in Bethany. Arbor Circle and my supervisor said at this point, their efforts for the rest of the year are on retention, doing events for current foster parents to say thank you. And then a lot of our recruitment events are more when there's like outside, like community events, but they'll get me the list of things that they're doing for the springtime as well.
So just curious.
Yeah.
So do we typically rely on our nonprofit partners in the area to help with those recruiting events, or is that something that your office specifically does, or is it both?
It is definitely both.
Okay.
We have a collaboration consortium of all the agencies within Ottawa County that meet regularly, and we both put on things together and separately. So I know an example of one of the things we're putting on in February is a prom event for foster moms, and for them to bring their friends with them as a possible. So it's like a recruitment and a retention event together. And that's all of our agencies working together. And then sometimes we do things separately, just depending on capacity.
Thank you.
You're welcome.
All right. Any other questions? All right. Thank you, Kendra.
Thank you so much.
All right. So this is now our second opportunity for public comment. If you wish to speak, please come to the podium, state your name, and you have 3 minutes to speak to the board. We have anyone who would like to speak? All right, looks like we have one. Welcome.
Good afternoon, Commissioners. And, want to extend you a happy afternoon or wonderful afternoon. I just want to take this time to respond to the article that was penned in the Simply American, I believe by the chair and his cohorts. So I'll start with this story. A man once interrupted Buddha during one of his lectures with a flood of abuse. Buddha waited until he had finished and then asked him, if a man offered a gift to another, but the gift was declined, to whom would the gift belong? To the one who offered it, said the man. Then, said Buddha, I decline to accept your abuse and request you keep it to yourself. To the chair, Marsha and I simply saying, we refuse to accept we decline your abuse and request that you keep your criticism to yourself. Thank you. As a commissioner, I cannot but overstate how immature that comes across. The equities and the optics involved simply shed light on who you are, a reflection of one's own insecurities and limitations. As John Steinbeck puts it, the critic has no choice but to name the victim of his attention into something the size and shape of himself. You see, Marsha and I should say, one thing, one of the most beautiful thing about Marsha is that her aspects of as a wife that I absolutely adore is truly and admire is her opinion. The most central thing about her is her opinion. Her advice and counsel is the hallmark of our marriage relationship, expressing her opinion fully and without any interruption from me, never has been in competition with my love and admiration for her. So to sum it up, Marsha is a real leader, as Andrew Miller puts it. A real leader has no need to lead. He's content to point the way. Thank you.
Thank you. Would anyone else like to speak?
I think I'll put my 2 cents into. I've been privileged today to sit here in this, what do I want to say? Not austere, but this meeting hall, listening to the various people talk, and listening to you as you go back and forth with your thoughts. What an incredible amount of talent we have here in this county. And I just wish there was a way for more people to get involved. There's so much good thought, so many good people in our community, but only a few want to participate. For the most part, most of what I've heard today was, well, a little bickering, a little back and forth, a little criticism. That's okay. We don't all think the same. But I think it's important to try to involve as many people as we can, because we're in kind of a unique situation here. We're in a situation where our culture is obviously changing very rapidly. There's a lot going on today that we can espouse and a lot that we don't want to espouse. And I'd like to, well, as you know, my main thrust is that we build and generate a culture that we want to leave to our kids and our grandkids. I'm totally committed to the kind of legacy that we leave. So anything we can do to enhance that legacy and along the lines of Christian values is the ultimate way in which we can do that. It means a lot of effort on each of us to communicate back and forth, to discuss, to talk about, to listen, and then come to a conclusion. Sometimes we won't agree, but that's okay. That's what a democracy is. It's where the majority of the people get involved and help to make decisions that keep our country free and moving forward. Thanks.
Thank you. Would anyone else like to speak? All right. As adjournment is at the call of the chair, I call this meeting adjourned. And we will come back in about 10 minutes. All right.